My name is Andres Maldonado, and I'm currently a fourth year resident at the Jacoby Montefiore Emergency Medicine Program in the Bronx. I've been asked to join this forum given my very personal experience with COVID-19 pandemic. In late March, patients had just begun flooding into the emergency department, and I was required to test them. Within a week, I woke up drenched in sweat, consumed by chills and body aches. I found a spare thermometer in my apartment, which I used to take my temperature, and had a low-grade fever. Initially, the possibility of me having COVID didn't seem possible. I thought I had the flu or some other virus. And as the days progressed, I was able to keep my fevers at bay with Tylenol, fluids, and rest. Whenever my temperature would go down, I further convinced myself that this isn't COVID 19. I let my program director know what was happening, and was advised to stay home as per hospital policy for at least 2 weeks, or until my fevers improved for 2 to 3 days. However, on my fifth day, I felt obliged to get myself tested, and on the sixth day, my coronavirus result came back as positive. I let my family and friends know and mentally prepared myself for a few additional days of being ill. I had read many reports about symptoms peaking between 1 to 2 weeks. However, I found myself completely overwhelmed by fevers unrelieved by Tylenol. I had lost my appetite to the point where all I had tolerated in days were gel and Gatorade, and my body felt weighed down by myalgias. My mind became foggy. I realized that I wasn't even able to recall some phone calls I had made earlier in that day due to the high fevers. On day 9, I was so weak that I woke up tachycardic, hypoxic, and taking a few steps to the bathroom caused severe shortness of breath. My roommate, who luckily is an emergency medicine intern, recommended I go to the hospital, and I was quickly triaged and brought into an isolation room. From the start, I was lovingly cared by my colleagues, and they initially tried to maintain me on nasal cannula. However, I further decompensated. The attending caring for me had called my girlfriend and told her that the idea of intubation is possible if I don't improve on high flow nasal cannula. And then later, I found out that an intubation cart was outside of my room ready for me if I worsened. However, thankfully, high flow nasal cannula sustained me, and I was able to turn a corner after being weaned off of high flow for 6 days. I returned to work in the ER after 2 more weeks of recovery, and my story captured the attention of the New York Times, CBS, Univision, Fox Business. I thought it was important to disseminate my story and to delineate the true threat COVID 19 has, despite race, profession, language, or age. We primarily take care of a Black Latino population in the Bronx. And during the initial wave of COVID, hospitals found themselves severely underprepared on how to protect staff and how to manage these patients. Uh, Policies by administration were changing constantly, and nothing was prepared before a pandemic was even a thought in these places. Um, I remember using it for 2 to 3 days because we didn't have any masks to give out, and they were being rationed out to people who would need them most. I felt bad donning full PPE for a procedure or for swabbing a patient because of the lack of gowns we had, and that would mean there were less gowns for nursing who enter the room a lot more often than physicians do. At one point, rain ponchos, were given out as PPE. Now, this angered a lot of our staff and providers because a lot of us choose to work in an underserved area in order to serve those less fortunate than us. Now, how can we properly take care of an already disadvantaged population amidst a pandemic if we cannot properly take care of ourselves? And that personally resonates with me. My trust was affected in the healthcare system at the time, especially since I ended up in the ICU and was very close to being intubated. Now, changes have been made in the 3 hospitals that I work in, especially now since the initial surge of COVID in New York City has passed. And things are better now, but we must focus on maintaining these changes and transparency in order to solidify this trust that we have between our providers, patients, and administration and the healthcare system in general, well before the situation worsens.